to everyone. Today I'm going to talk about Polyhydramnios, Transient, Antenatal Bartter syndrome, and MAGED2 mutations. But first, I'm a med student at Universidad Católica Santiago de Guayaquil, and here are my Facebook, Twitter, YouTube, and Instagram accounts so you can follow me and watch the other videos I have uploaded. Definition: Polyhydramnios is the excessive accumulation of amniotic fluid. Transient antenatal Bartter syndrome, known as the impermanent Bartter syndrome, a rare inherited defect in the thick ascending limb to the loop of Henle during pregnancy. Both of these pathologies can be caused by a mutation of the protein-coding gene MAGED2 or melanoma antigen family D2. This mutation was seen in male offsprings.
One of the main components of amniotic fluid is fetal urine, and some people are grossed out by that, but it's sterile. It's actually a necessary thing for the baby to have inside the womb, and it's a very efficient recycling system. The baby swallows it and pees it out, and swallows it and pees it out. Other things like lung secretions, nasal secretions contribute, but the primary ingredient is fetal urine. So around a full-term baby, there's about 2 quarts of fluid, and it serves lots of purposes. It helps to cushion the umbilical cord, help with the baby's growth and development, their limbs, their lungs, lots of different things. So it's very important. If a doctor notices that your amniotic fluid levels are abnormally low, which is called oligohydramnios, or abnormally high, which is called polyhydramnios, then they're going to consider underlying causes. You have a specific question about polyhydramnios or high levels. Sometimes the cause can be linked to fetal anomalies or genetic abnormalities, but more commonly we just don't know what causes it. Sometimes it's due to maternal diabetes. So if your levels are abnormally high, your doctor again will look into certain things and rule out possibilities. It's something we think about for labor too, because if your water breaks when it's not under a controlled environment, sometimes the umbilical cord can slip out before the baby's head, and that can cause a prolapsed cord. So if we know you have a lot of fluid, then we want to break the water under a controlled situation and just have it slowly leak out to reduce the risk of complications. And then of course we do keep in the back of our minds the possibility that it might be linked to different genetic abnormalities. If those haven't already been ruled out on ultrasound, then we'll assess the baby after delivery. In your situation, I suggest talking with your doctor about it, and based on their knowledge of your circumstances and all of your ultrasounds, they'll be able to tell you what implications there are for you. If you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/InterMountainMoms, and recommend us to your friends and family too.
Application in medicine. The study tries to determine the genetic basis of this disorder, provide information to the pathology that suffers. The information can be used to treat the modern time by detecting the mutation of the sequencing of DNA. Pros and cons. Pros. The treatment will help the patient their quality of life. The polyhydramnios caused by the mutation tends to be mild, so it may go away on its own. The antenatal Bartter syndrome is transient, meaning it's temporary. The fact that it happens only in male babies can be seen as pro as a cons. Cons. There isn't a treatment that fixes gene mutations, and cases can complicate, leading to the death of the fetus.
I am Dr. Suhasini Inamdar. I am obstetrician and gynecologist from St. Philomena's Hospital and Cloud9 Old Airport Road, Bangalore, India. Amniotic fluid index or AFI is measurement of amniotic fluid during pregnancy in the womb. It is a measurement which is taken by sonologist and it is given usually in millimeters or centimeters. The normal range of amniotic fluid index or AFI is 8 to 18 centimeters. And it is measured by a sonologist when you go for your checkups, and this is a very good indicator of fetal well-being and a healthy pregnancy. The AFI is measured by dividing your uterus into 4 imaginary quadrants. In each quadrant, then a clear pocket of amniotic fluid is seen and measured vertically. What I mean by clear amniotic fluid pocket is there should not be any fetal parts or umbilical cord in that area. So we get whatever is the fluid as a correct measurement. Then all these 4 measurements are added on and the sum is given to you as amniotic fluid index. Now there are 2 ways of denoting these indexes. One is you can be just told the measurement in centimeters saying that it is 5, 6, 10 or 12, or you are given some charts in which there are percentiles, and in between the percentiles your amniotic fluid index should fall. Anything below 5 percentile, 5th percentile or 5 centimeter is not good. Between 8 and 18 is good, which is called as normal AFI. Below 8 centimeter we call it as oligoamnios, and above 18 centimeter when the fluid indices are around about 20 to 21 we call it as polyamnios. The reasons for hydro and polyamnios and oligoamnios are very different. In oligoamnios, there are some factors which are related to mother, as in improper nutrition, strenuous lifestyle, hypertension during pregnancy. Some are placental indications which are responsible for oligoamnios, like poor functioning of placenta, and some are fetal indications which can be improper formation of urine in fetal body because of lack of one kidney or poor functioning of one kidney, or some blockage in the urinary bladder of the fetus. So these are the reasons what we normally get when we see oligoamnios. Another biggest reason is premature rupture of membranes, which we call as PROM. So these are the reasons for oligoamnios. Normally gestational diabetes in mother is one of the major reasons for polyamnios. So when you go for your routine checkups with your gynecologist and obstetrician, they see into AFI and feel very comfortable when it falls in a normal range. Otherwise, they'll advise you what is to be done to keep it under normal range and keep it in a safe limit.
Issue apply in Ecuador. The incident is low. Cases are very rare to find among the Ecuadorian population. Also, the treatment cannot be the best because hospitals don't have necessary equipment or medicine. There is information about Bartter syndrome in Ecuador and may be given to its rarity. And my final conclusion, this recent information about the effect of the mutation of the MAGED2 gene is important to consider so doctors can give a good and complete diagnosis and also give the best care during the pregnancy. As it's a gene mutation, there isn't a treatment for the MAGED2, but what can be treated is the polyhydramnios and the effects produced in the Bartter syndrome. Also, the disease are normally dangerous or lethal. Okay. Bartter syndrome is a rare genetic kidney disorder that is made up of a group of similar disorders that cause an imbalance of potassium sodium. Bartter syndrome can be caused by mutation in at least 5 genes. Mutation in any of the 5 genes impair the kidney's ability to absorb salt. Patients with Bartter syndrome will require frequent lab testing, periodic doctor visits, and strict nutritional diets. Here is his baby. Ethan. Bartter syndrome can include signs and symptoms like premature birth, failure to drive, growth retardation, mental retardation. Bartter syndrome becomes apparent before birth due to the disorder causing polyhydramnios. This is his wife right before she delivered his son prematurely. Here is a picture about her. Bartter syndrome is an orphan disease. It's non-profitable for the pharmaceutical companies to invest money to finding a cure or treatment. The majority of money raised by major charities is designed to well-established organizations, well-known illness. Here is his baby. Ethan is one out of 300 battling this disorder in the USA, and one out of the 7,000 worldwide. Here's a picture of her in her baby. Bartter syndrome can be confused with another syndromes. There are so many pictures about that baby.